Hi friends, welcome back to our YouTube channel. This is Dr. Sneha Ando. So today what we are going to see is about the respiratory illness, what is respiratory illness and what are the types of respiratory illness. So this respiratory illness, we have done three different videos. You'll be able to watch the videos in the following weeks, and in other videos they'll be given the description, so you can come back and revisit the video also. So okay, fine. Moving forward. So what is respiratory illness? So respiratory illness is nothing but if a tissue or organ is affected during the respiration means that is called as respiratory illness. Anything you're finding it difficult to breathe in the gas and out means that is the stage or that is a scenario where you have developed some or other respiratory illness. So that is what called as respiratory illness. So today we will be seeing about what are the types of the respiratory illness. So we have two different types. One is upper respiratory illness. Next one is a lower respiratory illness. So what? Okay, you might be thinking what is the difference between upper and the lower respiratory illness. So upper respiratory illness means if the region above the trachea, from the head to the trachea region, that is if that region is affected means that is considered as a upper respiratory illness. If the region below the trachea is affected means it is categorized as a lower respiratory illness. Fine. Okay. So what is the major scenario over here is the other main concern is the upper respiratory illness and the lower respiratory illness. If you take it, the more percentage of the death you can see in the lower respiratory illness. In the lower respiratory illness, you need to be taken care properly, and proper medication and hospitalization is required for a person to save a life. So that is the kind of issues is there. If you take the upper respiratory illness, for the most of the cases it is easily treatable, and the simple home remedies can help you to prevent this kind of infection, or might be able to develop your immune systems. All sort of things are there. But in the lower respiratory illness, it's bit difficult to treat it. If you take example for example pneumonia and all. Okay, so in this current scenario, everyone would have been thinking about okay, what is coronavirus and all those things. So, will we? What is the major issue about the coronavirus? Is actually the coronavirus is one of the reason for causing the cold. But here in the current scenario, it is now a novel coronavirus, that means COVID-19 is a new type of new strain of virus which is responsible for causing this flu. And still now the patients or maybe the person like me or you would have not have that kind of immune system in your body, so it is very difficult to fight against the new strains of the virus. That is the main scenario what we are facing nowadays. Okay, and in the corona or the COVID-19, if this is been identified in the early stages, if it's in the upper respiratory tract means it is easily treatable by giving a lot of antibiotics, and a lot of measures can be taken to treat the disease. But when it crosses this upper respiratory tract to the lower respiratory tract, that is a stage where the game starts. That is a stage where you need to be taken care properly, proper hospitalization, and maybe you need to be in the ventilator for oxygen support. So all those things are required in that stage. So only if the condition or the condition of the patient crosses this upper to the lower, that is a stage where the death ratio is much higher. Okay, so we'll be talking about coronavirus and all in the later videos. So this is just a small intro about the corona and what is the kind of issues which we are facing in the current scenario. Okay, now we'll talk about the different areas and different regions where this upper respiratory illness. Okay, so that is what we are going to talk about. So what is meant by sinusitis? Sinusitis is nothing but if the region around the nasal passage is inflamed, then it is called as a sinusitis. And the patient might be having a face pain, or maybe a running nose, or maybe headaches. So these are all some of the symptoms of the sinusitis. If you talk about common cold, in everyone in and around in your lifetime would have got cold or maybe a flu. Okay, so what are the symptoms you can see in the cold? You might be having headache, maybe running nose, sneezing, body ache, and in some cases you might be having fever, mild temperature. So these are all the symptoms of the cold. Okay, so that you have got it. Now, epiglottis. So, epiglottis means it is an inflammation in the region behind your tongue, a leaf-like shape. It will be there. It is actually there to prevent the food to enter the prevent the food from entering into the respiratory tract. If that region is inflamed, then you'll be having a difficulty in speaking, and your maybe your voice tone might be changing during that time. So that is all the things which you'll be facing. And pharyngitis means it is nothing but you'll be getting tonsils or maybe a sore throat, difficulty in swallowing food, all those things you'll be facing during that time. And laryngotracheitis means it is a region where it is a disease which causes you the inflammation in the larynx, and that is a stage where you might be finding difficult to breathe in, or maybe you have a barking cough. So these are all the stages of the laryngotracheitis. So I hope you're clear with this all this type of illness and what are the symptoms of it. And over here, all this type of things are easily treatable, and simple home remedies can help you to boost up your immune system in your body. So all those things will help you. And the most little bit risk for the, if you talk about respiratory illness, is epiglottis and laryngotracheitis. These are the two conditions where maybe not for the healthy individual. If they are a child below 5 years or the person who is above 65 or so, that is a case where the patient might be finding it difficult to breathe in and maybe to swallow the food and all. That is a case where you need to be admitted to the hospital and need to be taken care, and maybe need to take proper medications or sort of it. Other than that, it is easily treatable, and proper prevention steps if you are taken means you'll be able to uh, prevent yourself from all these conditions. Next, we are going to talk about the lower respiratory illness. So here, bronchitis, bronchiolitis, or pneumonia is there. What is bronchitis and bronchiolitis? Bronchitis means it's nothing but it's an inflammation in the bronchial, the lining of the bronchial area means it's called as bronchitis. If there is an inflammation in the bronchial region means it's called as bronchiolitis. Okay, so this is what the difference between this both, and both the things, the main common causing agents are virus. Okay, nothing else. So the most common agents are virus, and pneumonia means if there is a liquid or the pus is filled in the air sac, then it might be resulting in the difficulty of breathing. That is the stage it is called as pneumonia. Okay, so I hope you are clear with this, and if you have any doubts over here, you can always post in the comments. Okay, now we'll move off forward and we'll see what are the common agents which is responsible for you to cause this kind of infections. Okay, fine. So here I've given you what are the common illness and what are the agents which is responsible for causing you this type of infections. If you take a common cold, the most dominant agent which is responsible for giving you cold or flu is influenza type virus, and next might be rhinovirus or adenovirus, and almost 10% are coronavirus. Okay, so not in the current scenario, actually the coronavirus is leading the normal COVID strain, but in the normal times which you talk about, the influenza virus is actually in the dominant state. Mostly the people will be affected with the influenza virus. That's why the doctor mostly used to advise you to take this influenza type B vaccine. So it actually help you to boost up the immune system in your body. So all normally you'll be able to prevent the cold or the flu in the during your winter season and all. Okay, now so you're clear with the cold. The next we are going to see about the pharyngitis or tonsils. So the most common agent which is responsible for pharyngitis, if you see, means it is type A coxsackie virus. So this type of virus which causes the severity in the pharynx region. Sometimes it results in the ulcer also. So all this make it difficult for swallowing the food, or maybe a very sore throat. All those things it just related to. Next is the common, not very rare kind of thing are herpes and adeno, but it is very rare this type of agents causing you this infection. But if this is the responsible for causing that kind of infection, means it will be in the severe ratio. Severity will be high over there. Okay, and the next one is we are going to see about epiglottis. And epiglottis is mostly seen for the children's below 5 or maybe the old age people, and the most causative agent is Haemophilus influenza type B bacteria. So this is a common agent which cause you this epiglottis. Other might be other viruses are very minimum for you to get this type of issue or this type of illness. Okay, and laryngotracheitis means the most common agent which is causing this type of infection is para-influenza, are the most common agent which results for this type of conditions. Okay, and next is bronchitis and bronchiolitis, and here you will be seeing the most common agent over here is virus, not bacteria, and very rare to know is the fungus and the other parasites. Okay, the most common virus which results are influenza, rubella, and rubeola. Okay, these are the virus which might be the responsible for you to cause it, or it is completely nil. Okay, and next we'll be seeing about the pneumonia. So the pneumonia I told you before, pneumonia is uh, one of the main illness, or maybe you need to be taken care during this particular stage, because the death ratio or death percentage is much higher over here if you're having a pneumonia. Okay, so pneumonia has been split up into 4 different types. One is typical, atypical, then nosocomial, and next is the aspiration pneumonia. First, a typical pneumonia is a little bit severe. You need to be taken proper medications, all sort of that. And the causative agent over here is the Streptococcus pneumonia. That is the causative agent over here. And atypical pneumonia is called as mild pneumonia, or it might be it is also called as walking pneumonia, because the severity ratio over here is much lesser, and the causative agent, the dominant one, will be the Mycoplasma pneumonia, and the other causative agents are Chlamydia, Legionella, and Coxiella burnetii. These are the other agents which is responsible for it. And next one is nosocomial pneumonia. This type of pneumonia is mostly got from a particular community. That means if a patient is admitted in a hospital, and that is the stage, or that is the case where the patient would have got this type of pneumonia, then it is called as nosocomial pneumonia. And there is another one, immunosuppressant pneumonia. This is mostly seen in the HIV patients. If the immunity is much lower, this type of patient would get this kind of pneumonia. Okay, and mostly the causative agent over here will be gram negative and the staphylococcus species. Okay, and the final type is the aspiration pneumonia. This type of pneumonia you can see in the patient if you have any periodontal disease and you've been in the treatment or the medication for that. In this kind of patients, you can find aspiration pneumonia. This is not a particular type of agent which is responsible for this type of pneumonia. It's a kind of mixed flora. Any type of agents are responsible. We're giving you the list of agents which is responsible for causing you the pneumonia. So any type of agents are responsible over here, and might be it is in a mixed of one or two virus, or maybe one or two bacteria also might be responsible for causing this type of pneumonia. Okay, so this is all the small intro about the respiratory illness. I hope you are clear over here. And if you have any doubts in this video, you can always post it in the comments. I'll definitely reply to all your doubts. And please, if you do like this video, please click the like button, and do subscribe our channel and support us, so we'll be able to upload the videos further. Thank you very much for listening.